Hello, everyone, and welcome to today's health equity webinar on exploring systems change for oral health. If you do have questions throughout this webinar, please put them in the chat and we will try to answer them as soon as we can. You could also email any questions to the coalition's email address, and I will put that in the chat. But I would like to introduce Taryn. Taryn is the AZOHC advocacy lead, and as a longtime member of the AZOHC, Taryn aims to create space for advocates from various professions to come together and make meaningful changes in oral health policy. So take it away, Taryn.
All right, thank you so much for the intro and welcome everyone to our webinar today, Exploring Systems Change for Oral Health. All right, so let's jump right in. So systems do have a huge impact on oral health, but we don't often notice the systems in our lives. And so when we want to try and change any systems, we first must be able to see the systems that are around us. And that's really our goal today, is to practice a mindset shift towards thinking about systems. So today we're not all going to become experts in systems change through this one webinar. And we're also not going to get into the details of any specific strategies or like weighing the best way to accomplish systems change. But we're focusing on that first step of recognizing the systems around us and recognizing systems change. And so to accomplish that, I'm going to present several metaphors and examples to kind of think about systems abstractly. Because this is a whole different mindset, I'm going to provide all these examples and go at it from a couple different angles to help create that aha moment. And we're also going to go over two models of systems change that you can put into use. And for those of you in the audience who are already familiar with systems change, or some of these topics are a review for you, I do recommend engaging with this content to see what you might be able to take from it to help other people start thinking about systems too. So I'm hoping there's going to be something for everyone today. All right, so to start off, we're going to imagine a situation. This is our first metaphor. And so imagine you're walking around a park, such as depicted in the photo here, Steele Indian School Park in Central Phoenix. I live across the street. Most of the photos in this presentation are from this park. But so you're walking around a park, and the sidewalk ahead of you splits into two separate paths leading to different areas of the park. You have a choice to go one way or the other, but that's actually not the full story. So you didn't create these two paths. You have the choice. You could go left or you could go right, but these two options were already created for you by the park designers, the contractors who laid the concrete, and the park maintenance staff who keep the paths open to you. So you can imagine how your choice would be different if one of the paths was blocked by a branch, or one of the paths had a sign advertising a beautiful lake in that direction. So this is a very simplified metaphor for how systems impact our lives and our choices every day. Everyone makes decisions all the time, including several throughout the day that impact oral health. And while everyone ultimately has the responsibility to make their own choices, that doesn't mean that we aren't influenced by factors that make those choices easier or harder. And most of these factors originate in systems. So let's start off by defining a system. So a system is a set of parts working together to form a more complex whole. The systems are greater than the sums of their parts, creating different and larger impacts than any of its components. Systems are dynamic and often change, and the interconnected components of a system interact with each other, sometimes in unexpected ways. And any changes in those components are going to have a continuous impact on the other components. So if you change that one piece, it's all connected, it's very dynamic, and it can be complex. So some examples of systems include a neighborhood, an ecosystem, the human body, the internet, or a neighborhood park is a system. So I encourage you to share in the chat some other systems that you can think of right off the bat. And as you're thinking, I'll also add systems can range in size and scope and purpose. There's microscopic systems like a human cell or even like organs. Those are really small, fitting inside one human body. But there's also huge systems like the water cycle or the global economy, which is so big I can't even wrap my head around it. What other systems are coming to mind for you all? You say eco? Yeah, that's a big one. Schools, homeowners associations didn't say all systems were necessarily good. That's very true. They have many different purposes and many different goals. Yes, those are all great examples of systems. Ooh, education, early childhood, health, weather, ecosystems, food, nutrition. Ah, yes, yes, great variety of systems. I love it. So not only are there systems everywhere, but we care about systems because they impact health. I know there's some oral health professionals in the audience, and so we know that oral health is impacted by a variety of reasons. Uh, Factors like behavior, such as diet, exercise, smoking, things like that, have an impact on oral health, as do someone's genetic. Someone has like acidic saliva or something like that, that can impact oral health. However, research shows that behavior and genetics actually play a relatively small role in deciding someone's overall health and health outcomes. The other factors, called the social determinants of health, have a huge impact on someone's health. And for some review on what those are, these are the social, political, and environmental factors that affect someone throughout their life. So this includes education, healthcare access, neighborhood and built environment, the social and community context, and economic stability. So these social determinants, they impact everyone, but not everyone will have the same experience with them. And we see some unfair and unjust health disparities as a result of these social determinants. So a health disparity is a difference in health status, especially one that is seen as unfair. So many people and organizations, including the Arizona Oral Health Coalition, strive to address health disparities and achieve health equity, which means that all people have a fair and just opportunity to be as healthy as possible. And so recognizing these social determinants is a really big part of addressing health disparities. And also, just like social determinants of health influence health outcomes, policies and programs influence social determinants of health. So I've learned like literally earlier this week that some organizations call these factors the structural determinants of health. I couldn't find a lot of consensus on that. So I don't have that term on this slide, but I'm keeping an eye on it to see that might be a more popular term in the coming years. But we do know that these social determinants and these structural determinants, these policies and programs, act as sort of a larger backdrop for individual health outcomes. And so that's why the coalition seeks to change policies in order to have that effect on the social determinants, which then has the effect on promoting oral health for all of Arizona. And we do know that this is the case, that policies and systems impact health, because we see health problems with a large scope. And it's so large that it can't be chalked up entirely to individual behavior. So to expand on that with some examples here, when one or two students fail a test in a class, we know that those couple of students, they might need some additional personal support. So maybe they need some tutoring, or it was just a bad day the day they took the test, something like that. But when half the class fails a test, then you should start looking at other factors. Was the test designed weird? Does the book have incorrect information? What happened when half of the class fails a test? It really suggests that there's something else at play. And similarly, if one person had periodontal disease, we can see that that is a personal problem that we can address with a personal intervention like treatment and education. On the other hand, when about 4 in 10 US adults over 30 years old had any level of periodontitis, that's probably not a coincidence. It suggests that there's something more than personal factors causing the issue. So I would love to see you all share in the chat some priority health issues that you see affecting the people you serve. I do have perio on the slide, but you're welcome to share that again. I'm sure if 4 in 10 people experience it, I'm sure you see that affecting people you serve. But maybe you see other priority health issues as well. Access to affordable dental care. That's a big one. Yeah, we see that a lot. Fewer young children receiving dental screenings and well child visits in general. Yeah, that can be a big issue. Yeah, thank you so much for sharing. Any other priority health issues that y'all are seeing? Food insecurity. Oh, absolutely. And big ties to oral health too. Yeah, thank you so much. Yeah, so keep those in mind. We're going to explore more in this training how systems can be at the root of these health issues and potentially what we can do about it. So speaking of roots, I have another metaphor to share with you all. I'm going to paraphrase an allegory by Dr. Kamara Jones. So Dr. Kamara Jones is an educator whose work focuses on population health, and she has a lot of different allegories to explain complex topics. Highly recommend checking out her TED Talks. They're really great. And she has a lot about systems and systems change and systems factors and all these great things. The one allegory that I'm going to paraphrase today is the gardener's tale. So imagine that a gardener is planting flowers into 2 separate flower beds, pictured here on the slide by some amazing artwork. So one bed has the fertile soil, and then the other flower bed has this rocky soil that isn't very nutritious. So the gardener plants the exact same type of flower in both of these beds. And unsurprisingly, the flowers in the bed with the great soil grow really big. Even the weakest seeds are able to sprout and grow up real tall. But then in the rocky bed, many of the seeds don't sprout at all. And those that did sprout didn't grow as tall. So there's nothing inherently different about the flowers in the rocky bed. We can see that this difference is happening because of the environment that the flowers are in. So Dr. Jones emphasizes that unless we address the problem with the soil, no other interventions are truly going to help the small flowers. It wouldn't help in this situation to provide flower education about how to grow better, and interventions like adding more water or providing more sunlight aren't going to help as much either. The results are truly a result of this context of the rocky soil, and that problem is what needs to be addressed. And so that's kind of like a look at systems as a whole. So let's take a look at systems change now. So there's a lot of definitions and understandings of systems change, ranging from really broad to something very specific. At its most broad, systems change is a term used to contrast strategies that are influencing one individual. So an individual-based strategy aims to change one person's knowledge, skills, and behaviors. For example, educating patients about the correct way to brush their teeth, or helping one person get connected to healthcare. Those are some individual-based strategies. And then in contrast, systems change strategies focus on the surroundings to address the causes of the problems and not the symptoms. So systems change can also be described as shifting the conditions that are holding the problem in place. And when we're talking about why we focus on changing systems, I think these two quotes sum it up best. So they're here on the slide. The first one is that every system is perfectly designed to get the result that it does. And then the second one is that the purpose of a system is what it does. So I know these seem a little obvious, maybe a little too obvious, but stick with me because these are two core pieces of systems thinking. And so to kind of translate these quotes, because all systems are designed to get the outcome that it does, this means that if you want to change the outcomes, the system has to change too. You cannot change outcomes without changing the systems that produce them. And then similarly, the intended purpose of a system, whatever that is nearly irrelevant. The results that come from that system, even if they're unintended or different from what you were expecting, those are the true purpose of the system. And so we can explore this a little bit more with our next example here, which is the example of a sidewalk. So I have a picture of a sidewalk on the screen. This is clearly not Phoenix. I grabbed this from the internet. It's far too green and grassy. But this picture is showing a sidewalk with a desire path from people walking off the sidewalk. And when enough people walk in this area, the grass dies and it forms a kind of an unofficial path off the sidewalk. And so if the intention of this sidewalk is for people to walk on it, we can see that that hasn't really been successful. There's a desire path. People are not walking on the sidewalk. And so when we see that a system isn't working and we're not getting the result that we expected, it's really easy to have a knee-jerk reaction that people aren't using the system correctly and that they're using it wrong. And so in this example here, we put down this nice sidewalk for people to walk on, and all these troublemakers are walking in the grass and they're not using the system correctly. But systems thinking challenges that line of thought. So people's behaviors are neutral and they are a natural result of the system that they interact with. But still, we do see that we have a problem because the sidewalk isn't working how we want it to work. So how can we fix this problem? Well, first, before we start making any changes, the big question we have to think about is what is our goal of the system? So we know we want people to use the sidewalk, but why do we want that? So I know this sounds kind of like a silly question, but I promise this is not a trick question. Please share in the chat all the possible reasons you can think of for why we have a sidewalk. Why is there a sidewalk here? What is it for? Now, it's kind of a silly question, and now I promise you from now on, when you see a sidewalk, you're gonna be like, what's this here? And start thinking real deep about sidewalks. Hey, yes. I'm seeing to control where people go / protect the landscape, accessibility, stay off the delicate grass, keeps the grass green. Yes, absolutely. Some great reasons. Any other reasons to have a sidewalk? Direction, safety. Yeah, lots of reasons. Who knew? We have sidewalks for so many purposes. Yes, I got pretty much the same answers to use up extra cement. Who knows? Maybe just had all the cement or let's throw one down. It eliminates the cut through. Absolutely. Yeah, so these are all very good reasons to have a sidewalk. I had the same ones here. So this first one, maybe you want to protect the grass. And so the sidewalk is there for people to walk on a path without destroying the grass. From our picture, we see that's not meeting the goal. People are still walking on the grass. And so if this is your top priority, you're going to need some additional reinforcements to protect the grass. Strategies to do this can vary in how effective they are. I would love to go to the next slide, please. Thank you. For example, a sign might not persuade everyone. People can just walk around it. But a fence is more likely to convince people to stay on the sidewalk. Only the most dedicated of folks will walk on the grass if there is a fence blocking it. But on the other hand, maybe your top goal is to provide a fast and safe surface for people to travel on. So in that case, we see still the existing sidewalk is not meeting that need. People are finding a faster route. So what you might want to do in this situation is pave that new path, pave that desired path over to bring it up to the same safety standards as the other sidewalks. And while this is just kind of an example of thinking about purpose, we know that any real life system is likely going to have multiple goals and needs in balance. And sometimes these goals are contradictory or they need to balance each other out. And so you'll need to be strategic about how to maximize the outcomes you want. So just the thing to remember is to always reflect on that underlying need and the desired outcomes when thinking about systems change, because that will guide your strategy. And we do know that the systems that we see in the world, they do not impact everyone the same, and they aren't always impacting everyone fairly. So a system may benefit some people might not receive any benefit at all and are just kind of impacted neutrally. And a system can harm people. So when we strive for health equity through systems change, it means that we seek changes that will intentionally address health disparities. And that involves focusing extra resources, extra attention on communities and groups that are facing the disparities in order to correct for the imbalances that have been caused by the unfair or the unequal treatment. So any successful systems change efforts must identify and include harmed groups in order to undo and repair the harm with the new system. So coming back to our sidewalk example, we see that the desired path is a shortcut. And so this benefit of faster traveling, taking this shortcut, was a benefit available exclusively to people who have the ability to walk off the sidewalk and go off-roading. And we know that's not everyone. So it's an unfair benefit. If we're making a change, it's an opportunity to be more fair and make the impacts more fairly impact everyone. So if you put up a fence to protect the grass, no one can use the shortcut anymore. So technically that's pretty fair. And then if you pave the new path, it's now accessible for more people, including people in wheelchairs, people using canes, pushing strollers, etc. And so that is fair, and both of these are meeting your goals. And on the other hand, if you're considering another strategy, maybe like adding some paved stones, because putting in a sidewalk, maybe it's like too expensive, or you're just not able to do it soon, and this is kind of like an intermediate step. Uh, this strategy, it is sort of reaching your goals. It's protecting the grass around the path. It's a safer path than just plain dirt. Maybe it gets less muddy and when it rains and whatnot. Uh, but it's not accessible to everyone. It can be uneven, and so maybe if you're in a wheelchair or pushing a stroller, you're not going to be able to take this path. And so we still see a unfairness, and not everyone is able to access this extra benefit of a shortcut. So when we are changing systems, not only do we want to reach our goals, but we want to make sure that our goals are fair to everyone impacted by the system. And to be truly successful at our intention of addressing disparities, systems change efforts must undo and repair the harm that has been caused by the previous system. So this does require including people in your efforts to identify the issues in the current system and to develop the new and improved system. All right, so enough about sidewalks for now. They will come up later. But let's look at an oral health example. So let's imagine that a community health center offers dental appointments, but people haven't been scheduling. You may have experienced this or not, but this is going to be our example problem. So we know that people need dental care and that community health centers are providing dental care, but something is happening and we have this open schedule, but all these troublemakers aren't scheduling with our community health center. So again, let's flip that around and think about patients as a neutral actors interacting with the system. So reflecting deeper about this, I have our standard first question here about why. Why do we offer appointments instead of doing something like first come, first serve? Uh, please share in the chat what you can think of as reasons to offer appointments. Make sure the patient is seen. Yeah. Not be overwhelmed with a full schedule. Absolutely. Any other reasons to have an appointment system? Structure for patients? Absolutely. Access to meet the healthcare needs? Yeah, it can really help with access. Yeah, absolutely. That's pretty much what I was brainstorming too. Yeah, be prepared, set up the rooms, make sure you have the things you need. For sure. Having an appointment, being able to see who's coming in that day, it makes sure that you have everything you need and that you're not overwhelmed if everyone arrived at the same time. And it also helps the community health center have predictable operating hours, and people are able to pick the time that works best for them. So it is a mutually beneficial situation in many cases. And so then our next question is, who is impacted by this appointment system? So for more background about this hypothetical example here, let's say that the current way to make an appointment is to call the clinic during business hours and schedule your appointment over the phone. So based on that information about the current appointment system, who would you say is likely making appointments and who is likely not able to make appointments? Please share in the chat. All right, got some ideas coming in. Elderly may struggle making appointments. People without phones can't call. Yep. Sign language, nonverbal communicators affected. Absolutely. Who else is impacted by this system? True, those worried about cost. Yeah. Yeah, spot on. These are all different ways that people might be impacted. You know, if someone doesn't have a phone, if someone's at work, the language barriers, that is all going to impact who's able to call and make an appointment. So we're likely to see people who don't have any of those barriers are the ones who are calling and making the appointment. And so if we know that our reasons for having an appointment is to meet all these needs for the patients and for the health center, and we know some of the current problems with impact, how can the community health center increase appointment scheduling? What are your thoughts on that after what we've talked about here? Any ideas coming to mind on how this health center can increase scheduling? And this could be anything. Let's imagine that for once, resources are not an issue. Bilingual staff to speak to patients, absolutely. Online appointments, community health workers to help navigate the system. Yeah. And reflecting on your strategies, are these strategies going to help overcome these previous problems? I'm seeing so. Absolutely. Yeah, when we talked about who is specifically impacted or not impacted, I see these strategies absolutely connect to it. Nice. Thank you all. So thank you for going through this example with me. Of course, this is, again, as always, just an example. We know that lack of utilization has a lot of different factors in the real world. It might not be caused by the appointment system at all. You know, the location, the ah, my slides are flying. Spoilers. Anyways, yes, we know there's a lot of different reasons for lack of utilization. But when we are thinking about how to improve access and how to improve utilization, it is still the top priority to make sure that you are focusing on the intention and the causes and making sure that your solutions are going to impact that system in a way that is overcoming the previous problems. And this will likely require working with the group to identify issues and possible solutions. And as most issues are multifaceted, they'll have a lot of different causes and a lot of potential solutions, you know, that it will take time and it won't always be quite as simple. All right. Great work, everyone. You're already doing great with systems and systems change based on our example. All right. You saw this a little bit. Just pretend you didn't. But up next, I have our next metaphor. So this is a very popular metaphor when talking about systems. So I'll give you the highlights here. So imagine that two people are walking along a river when they notice some babies floating downstream. So both of the people jump in and carry the babies out of the river. Then more babies come floating down, and more folks start joining in to help with the rescue effort. More and more babies are flowing down this river, and people start devising all sorts of techniques and contraptions in order to get these babies out of the river and save them. Eventually, someone gets out and starts running. The people shout, "Hey, where are you going? We have to save these babies. You can't leave." But the person replies, "I'm going upstream to find out how these babies are falling in the river." So this is a very popular parable. You may have heard it before, but I do really like it to show how systems change can create long-term sustainable solutions that are addressing the root causes of a problem. I also really like this metaphor because it shows how it's important to have a safety net of people who are immediately helping those impacted by the problem. So there's people saving the babies, but then there's also someone running upstream to deal with the causes. And both of those are equally important. So I do love this metaphor. And it is very prevalently used in public health, and it's often used to visualize problems and interventions. And so the term upstream, I'm pretty sure originates from this story, but the model kind of imagines that the problem is at the end of the stream, and the further you go upstream, the closer you get to the determinants of health and the causes of problems at the top of the river. So we remember the social determinants of health from earlier. These are the societal conditions that promote health, such as housing, education, income, and community connections. So those are kind of the upstream factors. And then downstream strategies are going to be focused more on individual factors. So clinical care, health education, things like that. So the river metaphor is especially useful because it helps us understand how systems change efforts seem really far away from the problem, both in terms of time and space. So upstream interventions can seem very indirect because we're focusing energy somewhere different from where the problem is, sometimes very far away. Also, the results of upstream systems change efforts can take some time to manifest because the impacts have to flow all the way downriver, metaphorically. And so we can see a delay sort of when we do a systems change or an upstream change. It could take a while for all the impacts to manifest. And then finally, this model, I really appreciate it because it helps us understand that any upstream changes are going to change everything downstream. So just like any changes to a river is going to affect the rest of it. It can be hard to predict for any systems change efforts what all those downstream effects are going to be. All right, so coming back to our babies in the river story to explore how upstream changes make a difference for issues that we see. So we had our story. We had someone get out of the river and run upstream. The root cause of the problem in this story, we're going to say, is a broken railing that was next to a nursery. So this person who got out, they had to keep searching and keep searching. They had to go all the way upstream until they found this broken railing. But they did find it. And then let's say we fix that railing in that area of the river. So doing this and fixing the railing has a lot of different impacts. So when we installed the railing, our original goal was to prevent babies from falling in, which is successful, and that is great news for all the babies. And it also turns out that the railing helps other people from falling in too. So maybe before there's people who fell in, but they could swim out, and so it wasn't really like a huge deal. But now they don't even fall in, so that's really great. But then on the other hand, maybe we can think about how there was some people who wanted to swim in the river, and now they have a harder time accessing it because of the railing. Hard to say if that's a fair trade-off. This is just a metaphor. It really depends on the real life systems change that you're trying. But it is something to consider about how our impacts are going to affect many things downstream. Also in this story, we can picture that it's going to be a little bit before all the remainings who had all the babies who had fallen in, they stayed in the river and they flowed down, and it took a while for them to get all the way down there before they were rescued. But after that time has passed and all of the babies have been rescued, we see another impact that all the people who are spending time rescuing the babies can do something else. So just think about how much that's going to change other things in the community now that people have time to focus on other issues. So it's fun to think about it as a metaphor. At least I have a fun time with it. In real life, it can be hard to follow the stream from the problem to the root cause, or it could be challenging to think about all the downstream impacts, both intended and unintended, that's going to happen as a result. But the upstream efforts, they really are worth it because they create long-term sustainable impact on health issues. All right, so I just threw a bunch of information and metaphors at you all, so I want to take a moment to ask you all for a quick reflection question about what word or image is standing out to you from today. Please, I would love it if you'd share in the chat. What word or image is sticking out in your brain from our presentation so far? The only unacceptable answer is me getting kicked off the meeting and coming back in hurriedly. Don't let that stick out in your brain. The stream, the image, the babies, the sidewalks. Absolutely. Yes, thank you so much for sharing. Awesome. Thanks. All right. So let's get into the models of systems change. So as we know, and as we've been talking about, systems are super large and quite complex. So it can be overwhelming to think about how to change them. And thankfully, we have these two models here. These are two of several models. But what they do is they are helping us to understand a system because it explains it by breaking it down into easier to understand parts. So once we see these different components of a system, it helps us develop strategies to change those parts. So we have these two models today, which is PSE, or policy and policy systems and environmental change, and the 6 conditions of systems change. So we're going to start off with the policy systems and environmental change model. This model is more commonly used in public health or health promotion fields, so you may have run across it. But the policy systems and environmental change approaches go beyond health promotion projects and dive deeper into the systems that surround us. PSE approaches aim to promote healthy behaviors by making the healthier choices the easiest and most accessible option. This model defines policy systems and environmental factors as unique domains, but they do often intersect, influence, and reinforce each other. So up first is policy. The policies are the laws, regulations, and rules that dictate the ways of doing things. This includes public and governmental policy, like federal, state, and local laws. It also includes workplace policies, the rules in a park, as pictured here, the fishing rules, and includes other things like the approved school district budget or things like that. So I would love to see if you could share in the chat some examples of some policies that are coming to mind, maybe some things you see impacting oral health or things that you see in your role. And while you're typing those up, I'll share some examples of some oral health laws. So this image on the bottom left is pulled from our AZOHC advocacy toolkit. These are laws that are impacting oral health in some way. So we see laws regulate individual behavior, such as laws that limit how people can use tobacco in public, which thankfully those laws exist now. And beyond that, laws do also affect how businesses and state agencies operate. For example, Arizona has laws that establish some broad eligibility criteria for access or state Medicaid service. And it also has some laws about which services are covered by Medicaid. And there's other laws such as scope of practice or teledentistry regulations. There's a lot of different laws and other policies impacting oral health. Yeah, the policies for scope of practice and really dictating what healthcare professionals can do ends up having a pretty big impact on oral health. Our next component is systems. So in the PSE model, systems are defined as processes and structures. Personally, I can sometimes have a little bit of a hard time distinguishing processes from policy. The way that I have a kind of wrap my head around it is that I tend to understand systems as more about how we do things, especially how we interact with other people or things. So changing system factors will affect an organization's culture, beliefs, relationships, and goals. Thinking of an example of systems at the park was a little bit difficult for me, but I thought that the operating hours is a really great system that determines how I interact with the park, kind of determines how I can get there. And this gate is a really clear structure that is influencing how I interact with the park. So please do share in the chat some other examples of systems, some processes, some structures that are coming to mind. And again, while you think of those, I'll share some examples from oral health systems. So the processes and structures that are separating medical and dental fields is a pretty big example of systems that are impacting oral health. So we see things like separate health record softwares, totally different schools. That's some systems that are affecting how these two fields interact. We also see smaller examples of processes through the access program. So there are policies that determine the broad strokes about access eligibility, but system factors will impact how someone moves through the application process. So if that process is very cumbersome, like requiring interviews or the software that people use to apply, that process will impact how people are able to get the services. And if it's very difficult, we see less people able to receive benefits. And then the final element are environmental factors. So this includes physical environment, such as physical structures or the presence of programs or services. The next is social factors, which are the attitudes and behaviors of other people that influence someone. So kind of like peer pressure type things. And then the final piece of the environmental factors are economic factors. So this includes financial disincentives or incentives. So some examples of environmental factors that I saw at the park include the signage, which can help influence, where I walk around. And I also saw on the right here this mile marker on the sidewalk. So yes, we're always coming back to sidewalks apparently in this training. But this marker in the sidewalk, it marks that the path around the lake, I believe, is 1 mile. And so having a marker here can help support people's physical activity goals. And it's kind of like this visual progress that bolsters you. So it's an environmental kind of influence. So please share in the chat the oral health examples that you've seen. And some other oral health examples that I'll share while those are coming in are a school providing fresh fruit during snack time is a pretty big environmental factor. Also, health insurance offering a wellness incentive if you do certain protective health behaviors. That is an influential factor in the environment that will impact health. Nice. I'm checking back in the chat. See lots of great examples of the policies, systems, and environmental factors that are impacting oral health. Yeah, I love it. Right. So that is the PSE model. While you are in the chat, please do let me know which of these was the easiest to think of examples and which one is the hardest. Any of these, yeah, particularly easy, particularly difficult, please let me know. Mm. Got one vote, systems easiest, policy hardest. It really depends kind of what you see around. I see all of them. I've done this training, a few dry runs, and it seems like there's never a consensus on which one's the easiest or which one's the hardest, which I think is good because that means we all have different strengths and we could all help each other find all these factors. Awesome. Thank you. All right, so we will scoot right along to our next model. So this is the 6 conditions of systems change, and I'm seeing that the time is right at about an hour. I apologize that we had a little bit of an overtime here. We will share this recording as well, so I will breeze through this real quick. So the 6 conditions of systems change is a model that's more common in the nonprofit or social sector. It defines 6 factors split into 3 levels of visibility. So the explicit level is made up of things that you can see and name most easily. This level is usually the most familiar because it is the most visible and it is very impactful. So things in this level include policies, which we talked about before. These are rules, regulations that guide someone's actions. Practices are the stated activities within an organization and the stated activities of an organization as well. And resource flows are how money, people, knowledge, information, other resources, data, things like that, how all of those are shared, how they're allocated, and how they're distributed. So even though this level is very visible, changes at this level may not be long-lived or fully impactful without changes at other levels. And this next level is the semi-explicit. So this level includes conditions that are slightly less easy to define and measure, So the first one is relationships and connection. This is the strength of the connections and communication that we see, especially between people of different perspectives and backgrounds. The next is power dynamics. This is the distribution of decision-making power, authority, and influence. So shifting power dynamics and building relationships is really important, especially how we're building relationships across sectors. So this model highlights that transforming a system is really about transforming the relationships between people who make up the system. So this level is really crucial. However, changes at just this level may not be sustained if they're not codified into policies and practices in the explicit level, or if it's not supported by the third level, which is the implicit level. So this one is called implicit because it's not completely visible. So the only condition in this level is mental models, which are the habits of thought, belief, and assumption that influence how we think and what we do. So mental models are not visible. Even our own mental models, our personal mental models, are difficult to identify. Some of our beliefs are easier to recognize than others, but most of them are unexamined and unspoken. And diving into mental models and narratives could be its own training entirely. In fact, there's several of them available. So I'm not going to dig into them right now. But one important thing to know about changing mental models is that it often means challenging power structures. Mental models are often created by those with power, and it reinforces their own power and status quo. Kind of a history is written by the victors type situation. And so not only are mental models hard to identify, but changing them is no easy feat. But it is so important because all of these levels and all of these conditions interact and influence each other, and you need changes at each level in order to have a real sustainable impact. So there are a few examples in the document that really dives into this model. I'll share it afterwards. I'll just go over one example now, which is the Affordable Care Act. So this was a massive change, a massive policy change. We saw huge explicit level changes to policy, practices, and resource flows, and it led to millions of Americans gaining access to healthcare. However, what we didn't really see as much was a new public narrative and a new mental model about healthcare as a human right and not just a privilege. And so because we don't have that additional element, the Affordable Care Act is regularly under threat of repeal or reduction because it's seen as just a policy. So achieving change with multiple conditions and all these levels, it is a ton of work. And that's why systems change requires collaborative efforts of many partners, including those impacted by problems. So different groups are going to have more expertise in certain areas, which makes collaboration and partnership super important and super impactful. All right. So I encourage you to share in the chat after breezing through the 6 conditions, which conditions or levels are most familiar to you? Go ahead and reflect on that. And please let me know which one. Maybe implicit or explicit. If you're really familiar with power dynamics. And if that's the case, please let me know. I'd love to hear more about it. Right. So I have my final section here, just a few more slides. I'll be very quick about it. We've looked at a lot of information about systems and system change. And so let's look at some ways to identify if something is systems change in practice. So I'm going to go over some key characteristics that define strategies that are systems change compared to not systems change. And I do want to say first that there's nothing bad about strategies that aren't systems change. As we saw earlier, it's just as important to have upstream and downstream interventions. I just want to compare them for the sake of being able to make a distinction. So the first characteristic is a focus on causes as an element of systems change versus a focus on outcomes. So systems change will focus more on the causes of problems and changing systems in order to create those beneficial outcomes and prevent harmful ones. If a strategy is more focused on mitigating harms or helping people overcome existing barriers without addressing, what's causing those harms and barriers, that's not systems change. The next characteristic is population or community level strategies, contrasting with individual level strategies. So population or community level interventions will affect an entire group at once and cannot impact a specific individual. So an example of this is community water fluoridation. A city can't fluoridate one person's tap water. That would not be possible. So that is an example of a population or community level intervention. And then in contrast, an individual level intervention can help one individual at a time, though they usually are scaled up to impact more people with more resources being used. So an example of an individual level intervention is applying fluoride varnish. And I do want to note that providing a intervention or a service to every member in the community isn't inherently the same thing as a community level intervention. So the distinction is more of it's not a matter of scale, it's more a matter of strategy. And so, for example, applying fluoride varnish to everyone in a population would be very impressive, but it's not a population intervention and it's not systems change. It's just a very large scope program that is reaching the full population. So the next characteristic is if it is sustainable over long term or if it's more time bound. So systems change is sustainable, whereas a program or something that's not systems change is going to be time bound. So that is a pretty big hallmark. So systems change often requires less effort to maintain in the long run. So for example, a policy change, after you get that law passed, it usually requires less effort to maintain that in the long term. Though we do see policies be repealed, it's not necessarily permanent. But compare that to a program like an annual charity dental event. It's going to have a start and an end date. And if you want to do it again or you want to do it for longer, it's going to require the same amount, mostly the same amount of effort and the same amount of materials and resources each time. And finally, as we've mentioned, systems change must be collaborative. There are a lot of amazing things that any individual can do, but systems change is not something that can be done alone. All right, and the big tip on how to tell if something is systems change or not. So building knowledge, increasing awareness, or developing skills are never the final goal of systems change. If that is your goal, if that is your ultimate outcome, is you want someone to know something or be able to do something, that is not a systems change effort. However, it will likely be a step on the way because systems are made of people. So people might need training on the new software, or they might need to be aware of the new policy or things like that. But it's not the final goal. The final goal of systems change is going to be, changing policies, processes, norms, power dynamics, things like that that are in the context that are supporting and enabling behaviors. I do have a list here of some other ways to tell if something is systems change. I'm not going to read all of these right now, but I will share this information afterwards. So I recommend checking out this list. It will help you determine if something is systems change or not. And I will point out this bottom one. I think it's a really important one of if something relies on a champion to continuously maintain an impact or an effort, it might not be systems change. And some tips for moving from individual to systems thinking. So if you're seeing a problem, I recommend thinking about why that might be. You think about what's causing that factor and asking why several times. Keep in mind, there's not usually one reason that a problem exists. So by asking why over and over again, you're likely to find a whole web of causes. The next tip we've talked about is to think about people as neutral actors and focus on what around them is influencing their decisions. A really great way to help think about that is to think about what is making a behavior easy and what's making it difficult. So willpower is a finite resource. It's a finite resource. And so something that's going to make a behavior easier, something in their surroundings that's going to support that behavior is going to be a really big help and a really great example of systems change. And my final note here, so systems change can be very indirect and it can be a pretty big undertaking. So when we think about it, it also can sound a little bit wild sometimes. Uh, Talking about our earlier example, why aren't people scheduling appointments? Or maybe you're wondering why people aren't attending our events and we need to do something about it. Well, answering that problem by thinking, hey, maybe we need to build safer sidewalks. That can be a little bit hard to parse at first. But when you think about it, lack of transportation and having a hard time getting around can be a major barrier. And so that can be a root cause. But that is very indirect. It is very far away from the problem, as we've talked about. And because of that, it can be hard to get funding or approval for systems change efforts. This also means that not every organization can always take on leadership in systems change efforts. However, there are things that organizations can do in order to support systems change. As we talked about, it's a very collaborative process. And so even without taking on a massive role, organizations can support the efforts by providing input, helping make connections, and providing support in any way that is related to their mission. And finally, systems change can take a long time. As we've said, if people are currently impacted by a problem that is happening way upstream, it can take a long time to find that problem and change that problem. And even after you do, it takes a while for us to, be able to see the impact. So having people and organizations who are doing the downstream efforts to mitigate the damage are so important. And finally, my last recommendation, don't give up. It is so important to change systems to create long-lasting, impactful changes that promote health equity. And by focusing on the systems around us and participating in efforts to change those systems, we make a big difference.